Pastor, you had mentioned that the rate is getting better for the BIPOC community. What are the numbers, and how far does it have to go to reach parity with the rest of the population?
For the black population, it's only 3%. For the Latino population, 7%. So if we do an average, you're talking 5%, which really does not equate to what the need is when you look at the disparity regarding those persons, our people of color, our not just our communities, but the population of the BIPOC population, so that we're able to make a significant dent. That's why it becomes extremely important that a mass vaccination, thousands, Dunkin Donuts Center, a large venue that can handle a large population in a coordinated area, will make a significant dent, and I say dent, in regards to the disparities that are actually being shown right now.
Yeah, I was going to ask, where and when would you like to see the mass vaccination event?
We would like to see it ASAP. We cannot say where. We are still in cooperation. We are working collaboratively with the Rhode Island Department of Health, and we're sitting down with them. We are discussing different options, and we're hoping that that particular discussion will be finalized in the near future.
Do you feel like you have the governor's ear on this?
I feel that there are a lot of people that are working to help us, and as we continue conversations, we'll have more definitive response in regards to that.
Have you talked to him or his team about this?
That is being scheduled.
For when?
That is being scheduled. Any other questions? Yes.
In regards to vaccine reluctancy, so in these communities of color, I know we talked about the state having more of a ground in helping with this vaccine reluctancy. Is there anything that community leaders can do as well to help ease that?
We are actually addressing that. We are educating, we are informing. We are making sure that we're giving good information relative to making a good conscious decision. We cannot deny what has happened throughout generations. That is a given fact. However, what we're trying to do is educate and inform across all communities, so that when the opportunity arises for vaccination, you will not base your decision just on historical issues, but what we see currently.
I would add that not allocating vaccines to communities and not having enough people in the community vaccinated perpetuates not only this narrative around hesitancy, but it also leads the community to stop talking about the vaccine, right? Stop talking about whether they're concerned or not. I mean, that's really the issue here. It's people having a sense of hopelessness that they're not going to have a chance to have the vaccine in the first place. And so they're going to have to go on with their lives and take on risks that other people may not have to take on. And I will add that the administration of the Department of Health has presented opportunities, I would say, kind of like glowing ideals in front of us in terms of having a mass vaccination weekend. What we're trying to do is provide an operational framework where we're saying as leaders here today that we can be a part of that. That if we need transportation hubs, we will staff them. That if we need to mount people on buses and get those buses to whatever real estate we're given, we'll do the work. Just give us the space, give us the structure, give us the allocations.
Are you thinking about one location or several around the state?
We're open to the expertise of the Department of Health. Certainly, I think given the amount of BIPOC community, again, Black, Indigenous, Asian, Hispanic, Latino communities around the state, it can't be only in Providence. We know Pawtucket, we know Central Falls, we know Providence, we know parts of Woonsocket. We got Puerto Ricans in Middletown, right? Yes, it needs to be a multi-pronged approach, but we have to have our beacon of hope, and that is a mass vac site here in the capital city.